I'm going to start with Mr. Davis. What would your definition of a free market be?
One where you are able to bring goods, and if those goods bring value and the system sees value in them, you're able to bring those at a value you think is fair and reasonable and negotiate with the other sides in a world where you have free competition.
So right there you said negotiate. Most free markets are typified by this. And I'd like you all to listen to this because I think the big challenge, if I were in your seat running your companies, is that it's not a free market. A free market means you've got a lot of choices, you've got vibrant competition, no barriers to entry, and you've got an engaged consumer. Now, do any of those apply to your business?
I think all of those apply, but I think one thing we need to understand in the way our business functions, for a period of time, we have exclusivity. That's during the patent protection period. Thereafter, and in that period, we must reap a return on the investments we make to fund the R&D we do. Thereafter, drugs are freely available, and there is total competition in that space.
But yet you would sue to keep transparency in terms of what the consumer price would be or the list price. Or you do things like tweak patents. That doesn't happen anywhere else. And you're not alone there. Hospitals and insurance companies do all this stuff behind closed doors as well. So I would think if I were in your shoes, you've got maybe a few years before, so none of that stuff really applies to you guys as I listed it. You might try to spin it that way, but it's not the case. I fixed it in my own business back in, probably 15, 16 years ago by creating healthcare consumers, by trying to avoid the system through wellness and prevention, which you don't hear much about. But when you do need it, it's got to be to where you've got a lot of options, and I understand you're a little different in terms of the R&D that goes into it. And then many years ago, you created a monster called the PBM that now is sucking all kinds of money out of the market. Why can't you fix that in terms of doing alternative ways that would just smother the market with transparency and get it into a different channel of distribution? You got a guy like Mark Cuban that's trying to start a company at cost plus. You're going to probably need to find things like that, or you're going to be appearing more often here, and it's going to be where you're going to be regulated like a utility would be. Because in my opinion, you operate more like an unregulated utility, kind of cloak yourselves behind free enterprise, and now it's up to 18, 19% of our GDP. Something's got to give. Senator Sanders talked earlier about things costing 10% to 25% overseas, and I think I heard the excuse was, well, they have price controls. Well, I think I'd be smart enough to know that sooner or later that will occur here. It's going to be up to the industry to fix it, and you're probably just 15 to 20% of the problem. You could fix the part that you get the most heat for by maybe trying to get more customers like the business Mark Cuban is putting out there that's based upon transparency. If not, you're going to get all the people that don't own healthcare businesses finally saying, we're not going to pay through the private side, the insurance system, 3 to 4 times what it costs through government, and I'll let you complete the logical chain. You're going to have government as your business partner. So why would you persist in a paradigm that looks like you're going to be headed towards what you definitely don't want, and that's doing more business with the federal government? Mr. Davis.
Well, I don't want to speculate on the systems as a whole. I think what I focus on is what do we need to do to drive the mission of our company, which is in the near term, bring access and affordability, make sure that when we bring affordability, we don't sacrifice access, and often patients lose access when we try to address affordability, and that we fund innovation. And that's whatever ultimately we come to as a solution. If we can protect those elements, I think we will both help patients of today, and we can make the investments.
Have you ever looked at
in the
having
future.
some other system of distribution like almost any other manufacturer would have when you make something? You do a pretty good job making the pill. You completely default on how it gets from where you make it to who uses it. You're putting independent pharmacies out of business because of PBMs and other kind of peculiarities in the industry. Have you thought about at least in the place where most people confront the healthcare system with a prescription about trying to restructure that, smother it with transparency and options to where people can get their stuff, and then apply that to biologics and the entirety of the spectrum, and don't tweak the patents and try to preserve a broken system?
Yeah, so, we have considered, should we look at going direct? The reality of it is, as a single company, when you have now today 3 PBMs controlling 80% of the lives in this country, the ability to do that takes a portfolio of characteristics that we don't currently have, and I don't believe any one company can do that. That's why we continue to believe we need free market, but
I'll bet if you collectively got together with the other drug companies and encouraged others like a cost plus that Mark Cuban has done, to where you're going, I think you've got it under your control not to perpetuate a bad situation that was created by you. I mean, you make it. You don't have to necessarily use PBMs. Why don't you encourage an alternative structure? At least show us that you're wanting to compete. Because all I can tell you is that if you don't take the bull by the horns, do something different, you're going to be like all other countries. You're going to be dealing with the federal government as a regulated entity, and I think we could lose some things. But in the meantime, Senator Sanders pointed it out. It costs a lot more here. The healthcare outcomes are better there, and pharma, hospitals, and insurance better figure it out before it's too late.
Senator Hickenlooper.